Whenever I hear that introduction, it sounds like I can't hold down a job. So I do a lot of debriefings for first responders, and this is going back about 40 years ago. There was one in particular. I knew they had a bunch of bad fires and a bunch of bad car accidents, and so the fire chief wanted me to come and speak to the group. So it was more of a an education session. So there would have been about 40 all male firefighters there. So we set up for a time, and that morning I'm getting ready for the presentation, and I see the phone ring, call display. It's the fire chief. I'm thinking he's canceling, and he's not. He said, "We're all set for this afternoon." I said, "Yep, I'll be there, 1 o'clock." He said, "Well, there's a couple things you need to know about this crew." He said, "First of all, even though we're all male, we prefer to be called firefighters, not firemen." Well, that really threw me because my whole life I called them firemen. So I had a hard time getting my tongue around that phrase. And then the chief says, and secondly, and more importantly, is the guys really don't want you to come, which was really helpful. I'm going to a group of 40 fairly macho men to talk about feelings, and they didn't want me to be there. So I was really nervous. I got there early. They had 2 rows of chairs, 20 each in the fire hall, in a straight line. So I put them in a nice semicircle so they'd be looking at each other as they shared feelings. I went to the bathroom. I got back. All 40 were there, but they straightened out those rows. There was no such thing as a semicircle. So that even added to the anxiety. And I've been practicing my opening line since that morning to say, the stress that you as firefighters feel is incredible. Instead, I said, the stress that you as firefighters feel is incredible. And I still can't believe I called them firefarters, and they still razz me to this day. So about halfway through, I wasn't sure how the presentation was going, and the one guy at the back, he said, "Okay, enough of this path or this pact that we made," and he told the story about them 16 years previously responding to a single vehicle rollover accident outside the city limits. It was in the springtime, so the spring runoff was quite heavy, and this car had hit black ice, flipped over upside down into a very large ditch. And the car was upside down, and there was 14 feet of ditch water on top of this car. And they did not have a winch on the fire trucks back then, so they had to call a tow truck to lift the car, onto the bank of the road before they could extricate the person. And the guy said it took 13 minutes and 14 seconds for the tow truck to get there. 16 years later, he still knew exactly how long it took, because there was 8 of them that had taken off their bunker gear and were diving into that water, blowing air into that person's mouth. And when they got the car on top of the bank, it was a 17-year-old girl, many of which they had daughters that age or sisters. So they made that pact. We're not going to talk about this because we might cry, for gosh sake. We might not be able to do our work. And that's the message that they get. Don't talk, don't trust, don't feel, and for gosh sakes, don't change. I mean, that's the exact phrase that I needed. I could have just went over and given him a big hug and a kiss, which would not have been a good idea in front of 40 fairly macho firefighters. I share that story because that's the message about grief, especially complicated grief. I love this quote that for those of us who understand, no explanation is needed. For those of us who do not, no description is possible. So when you think about complicated grief, many people say, this is over my pay grade. I don't have the experiences. Because you attended this workshop tells me a lot about you folks, that because of the power of your presence, that's what's going to make the connection, is that at a time when they are struggling with meaning and purpose, which means we need to go to a deeper level, you're able to connect to them. And then the role of music is so powerful around that aspect of it. Okay, it's not forwarding. Oh, okay, I see why. That's my mouse will do it. Okay, I love this quote. We in the care partners community frequently encounter people with life-threatening illness or trauma or grief at a point when they are no longer they have been and are not yet reborn into they will be. We meet them in a place between no longer and not yet. No longer and not yet. That is very difficult for the people that we walk with and very difficult for ourselves. So you will be getting a copy of these slides. There's nothing worse than going to a workshop and having to work for it. So you'll get a copy of these around that aspect. I love this quote by Parker Palmer. One of the hardest things we must do sometimes is to be present to another person's pain without trying to fix it, to simply stand respectfully at the edge of that person's mystery and misery. Wholeness does not mean perfection. It means embracing brokenness as an integral part of life. Misery and mystery. So that's what happens when someone is struggling with a palliative illness or a traumatic death. It throws them into a world of misery. And the whole aspect of that is the mystery. And I don't mean mystery in a religious sense. It's mystery in the sense of how is this traumatic event affecting the meaning and purpose? And that's where often music makes that connection. I am not a trained music therapist, but I use music so much in the work that I do. And I'll explain that a bit later around that. Again, we're learning so much about trauma-informed care is that it's skill-based, that we need to know that an understanding of trauma, of approaching it with compassion and dependability, that there's this cultural humility, that they have the ability to overcome their trauma, and that it's all based around resiliency and recovery. So this was Sarah. She was 97 years old, living in a long-term care facility, congestive heart failure, and nonverbal. And she would scream at the top of her lungs all the time. So the nursing staff asked, can you just sit with her and try and get the screaming to stop? So I went in and I tried everything, holding her hand. I even tried singing, which made the screaming worse, which makes sense. There's a reason why I'm not a music therapist. I cannot sing. And but I noticed there was a tear coming down her cheek, and it just stopped there. So I thought, oh, that must be uncomfortable. So I just brushed it off, and she stopped screaming. I waited about 8 minutes. She started screaming again, and it was more like a deep moan. And then I just brushed her cheek, and it just calmed her down. So I did that for about 2 hours. Then I, next day, got about 12 people together, 12 volunteers, did a little training program, and we were able to spend 18 hours a day, each about 2 hours each, just gently pressing her cheek. We had no idea what was happening. Every organization that I work with, I always bring the Room 217 CDs, so they're always playing in the background. But it was more of the stroke that was doing this. And then her 3 sisters were coming from Europe to say goodbye. So they were in their mid-80s to late 80s and early 90s, but well enough to travel. They wanted to say goodbye to Sarah. So when they came in, I told them about our volunteer program, and they said, oh, we know what that is. And I said, what's that? She said, well, we lived in a war-torn country, and the soldiers would come in during the day, and to protect us, Sarah would put manure all over our faces so the soldiers wouldn't touch us. And then at the end of the day, she would wash off the manure and tell funny stories, usually about the soldiers that she would make up. And they were so funny that we remember the funny story. We don't remember the manure on our face. And I said, oh, well, which one of you washed off Sarah's manure? And there was that long pause. And they said, oh, she did not put on manure on her face so that she could draw the attention of the soldiers, so that it was a way of protecting us. We never know the stories that people are carrying, and we don't necessarily need to know them. Sometimes it's too much trauma to tell it, but if we hold that trauma and hold that person, we can provide excellent and compassionate care. And that's why the power of your presence is so powerful in dealing with that aspect. So my introduction to Room 217, met Beth at a conference. just had started, and I purchased my first set of CDs at a conference. Now, I started using them right away. I was captured by the Celtic Whispering CD. I had never heard that music before, and it just did something to me. So I played it anytime I was presenting on hospital rounds. So that's docs and nurses coming in before their busy day. They're rushing in, and I would always have the Celtic Whispering CD playing, and you could just see them lower down. I have no idea the reason why, but it made my presentations much, much more powerful, and much more receptive. And then I started doing them also right before first responders, debriefings, and any kind of presentation. So I've never done any clinical research on the impact. I think it's the tempo, the kind of music, it's kind of an invitation to get reflective. And we are talking about hardcore first responders. That's really tough to break, and how wonderful it is in dealing with that aspect of it. So what I know is that, music is a tool for grief. Grief is a personal, complex emotions, and people process it differently. But music can touch them in ways that words cannot. We cannot think our way through a trauma. We need to feel it. And that's where music can be so helpful as that tool in dealing with that aspect. So I ran a men's group where there was 12 men who had experienced the death of a child. And it just happened that one of the dads said, well, there was this one song that really helped me get through the early stages of grief. So the next session, I said, so everyone's going to have an opportunity to present a song and explain it. So all 12 had one. The next 12 group meetings, each gentleman presented the song, played it, and then they were able to say the impact, and then the other men could have a response. I have since incorporated this in every group I do. I now do it with bereaved moms. I do it with bereaved parents groups, and any type of loss. I'm just completing a group of women who have experienced the death of a partner through suicide. And again, how that music can get to parts that takes traditional counseling so much longer has really been helpful. So that's how I've been doing this for the last, I would say, 30 years. It's having a huge impact about that. So there is a connection to this. So what we know is that we have what we call the amygdala hijack. So the amygdala is the oldest part of the brain. It's right here. And in low emotions, our higher cortex is in control of everything. But when we're dealing with high emotions, it disables the cortex. The amygdala takes over and it goes to fight or flight. And that's where often music can get you out of the fight or flight. And that's what I find is so helpful in dealing with that. But when you're in fight or flight, what happens is the hormone cortisol gets released. And it's very important to put the body on guard that I'm either going to have to do a fight or flight, or I might have to freeze or fade. But that cortisol stays in the body a long time. So with somebody with complicated grief, they're activated all the time, and that's what's really hard on the body. And this is where we store the extra cortisol in the fatty tissues, and therefore it gets access quite even when you're not stimulated by the fight or flight. So that's where it makes a difference. And we know that music allows that whole aspect of in a trauma. One of the studies found that it emotionally lifted by the experience. It releases oxytocin, which is the feel-good drug, which can reduce cortisol. So that's where the research is really strong about how it sets off oxytocin and diminishes cortisol, how helpful that can be. They did a research study on tears. So the tears that you express when you're sad is filled with oxytocin, but they analyze the tears that happen when you peel onions, no oxytocin in it whatsoever. So there is a role for crying. And I often say that tears are a sign of strength, not a sign of weakness, and they're very welcomed here. So this is my granddaughter, Julia. This is why this cortisol is really important to me. I said, Julia, what are you doing? She goes, oh, I'm French, so I'm a Pepe. She goes, Pepe, I'm trying to be just like you. So I'm working on it. The belly fat, I've lost 10. I got probably another 30 to go. So I'm working on that, around that aspect of it. So just some information about complicated grief. And it simply comes down to sooner or later how comfortable we are with ourselves and others, and the whole idea of dying and grief, because working with the dying and the bereaved often involves more being than doing. At a time of crisis, people say, just don't stand there, do something. But a time of complicated grief or trauma, it's just don't do something, but stand there, and how important that can be. I had an opportunity to take the compassionate leave program to be with my dad. He was 90, dying of lung cancer, and I wasn't sure when to take the compassionate leave program. So my dad just said, "Oh, come now." So we had like 3 really good months, and then he became the lung cancer spread to the bone and severed his spinal cord, and so he was bedridden. So it was 3 months then of hard slugging, but all the richness that we had around that aspect. As you can see the picture in the background, my dad is the 13th of 15 kids, and there was only 2 of them left. So just learning more about those losses. And my mom died when I was 19, and I was shocked at how much we as a family had to rework my mom's death some 46 years later. So we grieve in all 3 tenses, the past, the present, and the future, which is important around that. I have this on my mirror every time I look at it when I get up in the morning. The truth I believe and cling to makes me unavailable to hear anything new. I am shocked at the blinders that I have on, and how it's so important to be aware of taking those blinders off and how important that is. I was so fortunate to have this early in my palliative care career. Mom was diagnosed with advanced breast cancer in both breasts, multi-node involvement had already spread to the bone and to the lymph nodes. Prognosis was very poor. They decided to tell her 8-year-old brother, but not her. And she was acting out in school, so they asked her, they asked me to spend some time with her. So we know kids don't do great with big people style of counseling. So I asked her to draw a picture of her family, and this is what she drew. So as you can see, mom doesn't have any arms. Everybody's but smiling but her, and the sun was there, although at the bottom of the page. And that was the sign of hope, that there was hope here because the sun was there. So when I asked her to explain it, she said, well, mommy used to give me the bestest hugs, and mommy doesn't hug me anymore. This is going back about 40 years ago, where she would have been in hospital for about 3 weeks, maybe 4. I think she had some infections from the surgery. So we got a chance to really work with them around that. And so I asked her, I said, well, and then she said, everybody's smiling, but I know there's a reason that we're not smiling, that we shouldn't be smiling. So I asked her to bring the picture in, and she explained it to mom. And what mom was unconsciously doing was starting to shut down emotionally. It was too hard to be able to talk about dying. And so it was unconsciously shutting down. And then this little girl, because of her courage, mom could see that. And then she said, you know, what's your biggest concern? She said, oh, mommy, you're not going to be there for my wedding. I remember going back to the nurse's station saying, a 5-year-old and a wedding? And the nurses slapped me on the back of the head, and they said, what's going to happen in June? It was 1982. And I said, I don't know, World Series? They said, no, Princess Diana's getting married. And every mother and daughter are focused in on that. It's a huge occasion for mother-daughters. And the mother responded beautifully. She says, well, when I get out of hospital, we're going to go shopping. I'm going to buy some special jewelry that you can wear for your wedding, and some special material, and some that we can make out of a dress. And then you and I are going to sit down and select the music that we'll play. And that was so powerful that for the next 2 years, that music was the connecting for it. And they had two quality years before mom died. About 18 years after this, I got a lovely invitation from this family to attend their wedding. I worked with them for a couple of years after mom had died. And all that music, which was a connector for the last 18 years of her grief work, was very, very powerful. And I remember using a lot of that music during our sessions, which was helpful of it. It's very important to remember that grief is not an event, it's a process, and it's a long process. Our society says you've got 3, maybe 5 days to get over it and should be back to normal. The latest research out is the death of a child, the death of a loved one takes between 2 to 3 years just to get over the initial impact, and the death of a child between 4 and 5. I tell bereaved parents that, and they breathe a sigh of relief because they say, it's been 4 years since Johnny died, and I still feel like I'm going crazy. So, whatever your role is, whether it be professionally or personally, in reaching out to people, it's that little planting seeds of hope that they will be able to get through this. That um, grief, you never forget the grief because it's a reminder, but the pain does soften, and that's that planting of that sign of hope. I would invite you to go and sometime, I always use this with all the folks that I work with, to do a loss history graph. So you kind of plot all the losses, and then you get a chance to be able to explain it and see. And the longer the line, the more significant the loss. So I'm a 56 model. I'll just do mine quickly. In grade 2, it wasn't a death. It was more a death of a dream. So I wear longer hair for a reason. Under this hair is a set of years you would not believe. Not that they're so big, it's just they really stick out. Short hair was very in style when I was a kid. I was horribly teased about that. So it was more about a death of an ideal or a dream that was difficult. I had two grandparents that had died during this time, and then my mom's death. She had severe arthritis that had left the bone and entered all the vital organs and died suddenly at 46. Um, I was diagnosed in 80 with a mild type of arthritis, which has not caused me any problems, but it was more of the psychological aspect of it. Our first pregnancy was a miscarriage, and the most compassionate thing I could say to my partner was, "Oh, promise me you'll call your sister." Um, and then we had a dog die in '92. So it just be important to plot that, and it's really helpful. What was the information you got about loss? Because our first two deaths are pretty well going to tell us how we handle death in the future. So it gives us a chance to work back and say, what was the misinformation? What was helpful? What was not helpful? And what do I need to change around that aspect? So those stages of grief, this is what the roadmap many people expect and what society tells us, but it's more like this. It's not linear at all around that. Another very powerful experience at that nursing home, long-term care facility. The recreational therapist, any new admission, they would do an assessment, and one of their questions was, have you ever experienced the death of a child? So I read all the charts when I started, and the Friday before Mother's Day, I was able to identify 12 residents who had all experienced the death of a child, and we had a group. I wanted to be no more than 45 minutes, didn't want to tire them out. And out of the group of 12, one died from a car accident, one from a farm accident, one from cancer, and the other 9 were from pneumonia. The average age of this group was 92. And after 2.5 hours, we had an incredible discussion. And it was the one that was 98 that said, it's been 72 years since I talked about my daughter. This is going to be the best Mother's Day ever. So again, people need to talk about their loved ones, to say their names. And this was one of the groups that we also incorporated afterwards. Did you have a particular song that got you through the grief that was helpful? And they did. They all had a particular song. Half of this group, it was a religious song that gave them connection to their past meanings around that. It's funny with the men's group, that was a much more younger group. Um, I was shocked at the number of artists, musicians that have experienced the death of a child. And all ranging from punk rock to acid rock to country and western to classical. It was such a rich experience, and that's why I incorporate that. If you ever get a chance to look at Alan Wolfeld's companioning model, it's wonderful. It's more of a philosophy. It's about being present for people. It's my favorite one about going into the wilderness of the soul with another human person, and we're not responsible to find the way out. I was always trained to listen to respond. As soon as I do that, I'm not listening. It took me a good 5 years to retrain my my approach is I now listen to understand, and information will come up. Something will come up that will allow me to go in the direction that they need to go. It's about honoring the spirit, not the intellect. It's about listening, bearing witness, walking alongside, sacred silence. It takes a long time for people to think. I was trained to be able to fill up that, and that's not very helpful. Respecting disorder, learning, and that compassionate curiosity, not the expertise, how helpful that can be. I just find this so powerful about partner loss, the death of a husband, they're protecting them, the umbrella out of reach, and her clothes in the duffel bag again out of reach around that. So the use of music and art can play such an important part. We're just starting to come out of the fog of COVID, has been my experience. We were not ready for this kind of grief. We had all these beautiful rituals that were very helpful, and we had this instead. I was at one of the long-term care facilities before the military came in Northern Ontario. So there was a team, the whole nursing staff were sick with COVID. So they had absolutely no nurses. So we had 25 deaths in 5 days. I knew nothing about an iPad. And so no one could come in. So everybody said goodbye via an iPad. Luckily, the first death, one of the granddaughters wanted to say goodbye. And she said, "Can you please press the iPad up against my grandma's lips?" I said, "Sure." So I did that. I said, "Why did you have me do that?" She said, "I took a screenshot." I said, "What's a screenshot?" She goes, "Give me your email address." And so she sent me this beautiful picture of her kissing her grandma screenshot. And I said, "Okay, can you teach me how to do that?" So the next 24 deaths, people had that opportunity to do it. So again, that kind of trauma, we're just starting to come out of the fog, and we will have to deal with that aspect. I invite you to do this. I call this the hug blanket. You can get these at Giant Tiger. They're made in Canada. They're about $4 at Giant Tiger when they come on sale. And I get all my clients that are working with to draw a picture of themselves so that their loved ones can wrap themselves in a hug. So I thought I would do one for Julia, and I'm showing this to show you don't need to be an artist. Not sure why I made the arms so long. Not sure why I put muscles on both sides of my arms. The muscles are definitely not big. The waistline is not that contour. I've written a book and a bunch of articles. I still don't know how to spell, but I think I nailed the glasses. So I encourage you to do this for yourselves. Make one for your people that are very connected to you. That can be really helpful around that aspect of it. Again, we're learning so much about grief, and I'll give you a chance to read this when you get the slides. There's those early response, the complex grief, but there's also a lot of resiliency around that can be very, very helpful in that aspect of it. I was very fortunate when I worked at St. Joe's in London. I was on call my first week. There was 4 deaths up in the cancer floor, and then they said there was a nurse that was doing those midnight shifts. And I noticed that she would open up the window after a person had died and the family had left. So I thought it was policy, procedure, protocol to air out a room. And I realized, oh, that doesn't make sense. So I asked her, and she said, well, for many of these patients, I've known them for 3 months, 6 months. I've heard their painful stories of goodbye. And this is just my opportunity. I open up the window, I take a deep breath, I blow it out. I'm thankful for everything they've taught me. I take another deep breath and blow it out, and I'm appreciative for everything that I've given them. And then I set them free because I know that that damn call bell is going to go in a few minutes, and I don't want to be robbed of that experience. So as we're journeying, developing self-care techniques that allows us to get it from here to here, out here, so we can continue to provide that excellent and compassionate care. These are just some myths of grief that we all need to know that are helpful. Keeping busy is a remedy. Not talking about the death makes it easier. Time heals. As time goes, as I say, the pain softens, and that is helpful. There's only one way to grieve. I always say to people, there's no right way or wrong way to grieve. There's your way. And I'm here to witness that. Um, Grief is a short time, and it's a very long time. You don't move away from grief, you move with grief around that aspect of it. Um, Anticipated deaths are easier. Um, Whether it's anticipated or sudden, devastating losses. Personal belongings should be disposed of immediately. Again, it's the agenda of the people. Whatever they find helpful is really important from that. We have this natural response to protect kids from grief. What we know is kids can handle the known. It's the unknown that they can't handle in dealing with that aspect. So I love this model here that in the beginning, grief is so big because life is very small around the loss. But as life gets bigger, the grief stays the same, but it's the life that the hope, the resiliency that allows us to deal with that aspect. Again, a very powerful debriefing I did, and it just says how complicated grief can come out in so many different ways. A 52-year-old mom was driving this car, and she had her 26-year-old daughter in the passenger seat. Somebody had stolen the stop sign on a country intersection. So where they should have been stopping, they went through and they were hit broadside and thrown into the cornfield. So they pulled the 26-year-old out here, and she had vital signs absent. So it was a young firefighter who started doing chest compressions. And when he unbuttoned her blouse, he noticed that there was breast pads, that she was a nursing mom. So he looked here and could see a car seat. But then the mom woke up and said, yes, she has an 8-month-old baby, but the baby's at home with dad. Air ambulance came and took her to London, and she didn't survive the car accident. So I did the debriefing about 6 months, 2 weeks later, and there was 40 firefighters there. And this guy, the one that did the resuscitation, his wife was there. And she said, I'm not leaving until you tell them what you're doing. Well, he'd get up at 4 o'clock in the morning and he would drive to the cornfield. He wasn't really going into the cornfield, but he was searching for the baby. As the story gets told, he has a 4-month-old at home. That's why he knew what a breast pad was. He wouldn't have had a clue what a breast pad was. So it was more of a search for meaning and purpose. Like, how am I going to protect my 4-month-old? How am I going to do this work as a first responder in all of this tragedy? And the fire chief said, oh, okay, get in the truck. I'm taking it to the hospital. And I said, well, just wait a minute. I said, is there anyone that kind of works the same shift as him and you could come with them to the cornfield? So 2 guys, they would meet at Tim Hortons at 2 in the morning, get a coffee, and then drive out to the scene and just sit there and talk. They did that for 3 nights. Then the next 3 nights, instead of 2 in the morning, they would go at midnight, right out to the scene. And the next 2 nights, they would just stay at Tim Hortons. It was really neat. The OPP officer got wind of this, and he would park his cruiser about 100 yards away just to make sure they were okay. Um, that kind of support, that kind of presence is what allows people to do the work they need to do to make sense of this complicated grief around that aspect. So we know that the six central needs of mourning is to acknowledge that reality of the death, embrace the pain of the loss, remember the person who has died, developing a new self identity, and there's that search for meaning. And this has just come recently. There wasn't that search for meaning in the early models of complicated grief. And then we know that grief isolates you. So the more that you can receive ongoing support is what's really crucial in dealing with that. These are Alan Wolfelt's morning rites. Um, I highlight you to this one: grief bursts, grief attacks, grief spasms. They'll come out of the blue, how important that is. Um, the right to make use of ritual. And ritual is not just the realm of clergy and chaplain. We can partake in those rituals. The ritual of making the hug blanket. I have a ritual every day when I come home. Um, I have a big maple tree that I whack real hard, and I put everybody that I'm walking with during the day on the tree with the promise that I'll pick you up in the morning because I need me, my family needs me, and how important that is. So these morning rites are so important. Again, that search for meaning and purpose is so important. So just a little comment about spirituality. So often I'll say, so how are you folks coping with this spiritually? And I'll say, oh, we don't go to church. I go, well, that's not quite what I meant. And I explained this. Spirit means breath. Soul means from the depths of you. So how is this trauma? How is this grief affecting your vital breath from the depth of your being? Uh, Please use that. Wrestle with it. Put your own terms to it. I've got more mileage out of that because it's really helpful in dealing with that. Because that spiritual care, that vital breath from the depth of them, it's about presence, attention, respectful assistance, helping people discern in this search for meaning in their life right now, in this new environment and pain, as meaning as life unfolds around that aspect. Again, Parker Palmer, he works with teachers, and he says the soul speaks in truth only under quiet, inviting, and trustworthy conditions. So, nursing staff, when I was doing home care, they said, we've got this woman that horrible trauma, horrible history of sexual abuse, and we finally convinced her to see you, but she's really reluctant. So I read the chart. She was on disability. I knew that it was the end of the month and she wouldn't be getting her disability check yet. So probably funds were very low, and she had pancreatic cancer. And so the only thing she could eat was bananas. So I show up to her door with, I still remember the price, $3.13 worth of bananas. And she opened the door and she looked and she said, how did you know? So it's those little connectors that you need to get connected to the physical before you can get to the emotional. And often it's music is the door to that. That can be really helpful. So just a little bit about difficult grief or complicated grief. It's usually the circumstances of the loss. There's a new diagnosis in the DSM-5, which is what doctors use to diagnose psychiatric illness, and it's called prolonged grief disorder. And some people say that, well, grief is a natural response to loss, but with this DSM-5 diagnosis, we now can get insurance companies to pay for the therapy. So there is some benefits to it, but it's usually the circumstances around the loss. So the death of a child, a sudden, unpredicted death, like a car crash, death by suicide, death by drug poisoning, all those things are usually would get into that prolonged grief disorder. If there's concurrent losses at the same time, looking at unresolved loss issues, it all depends on the relationship they had with the individual. So again, complicated grief is known as chronic grief, and it's the symptoms last over a year. So that's what can make that difficult. And those would be some of the symptoms of it. You're going to have all these slides. I'm going fast because I really want some time for you folks to have a chance to have a discussion around that. So here is the criteria for that prolonged grief disorder. So we actually have that, and it's only a family doctor, psychologist, or psychiatrist can diagnose, and a nurse practitioner. So I always work closely with one of them so that you can get this diagnosis early, and then it opens up the funding for it that can be helpful. And look at this tool of assessing for this prolonged grief disorder. It covers all the criteria, and then you can have kind of a really good assessment of what is happening. So this is Julia. I had her for the weekend, and then I sent her home, and her mom was saying, okay, Julia, what would you like for breakfast before you go to nursery school? What do you want on your toast? And she goes, Smarties. I got busted. She goes, well, you can't have Smarties on your toast. And she goes, well, you better get me back to Pepe's. Then Julia, my daughter said, Julia, how did Pepe keep the Smarties on the toast? She goes, Nutella. I got double busted. Well, here's my rationale. As long as you use whole wheat bread, and she says her prayers once a month, good to go. Smartie sandwiches. Again, the cortisol thing is very much connected to that window of tolerance. So this is where we need to stay in our window of tolerance so that we don't get into hyperarousal, or if we do, how to get out of hyperarousal or hypoaroused, that freeze. And it's 4-4 breathing gets you out of that. It's like rebooting the computer. You breathe into the count of 4, you hold to the count of 4, you breathe out to the count of 4 and hold. So if you look at all the special ops teams, the Canadian Special Forces, all those, they do 4 steps, because they're using 4-4 breathing, so they stay out of fight or flight. So this is what allows us to keep the cortisol low and stay regulated, and also doing it a long term around that aspect of it. Elizabeth Kubler-Ross, who developed the stages, she came in 1965 to work in University of Chicago. And before that, she went to all the death camps in Dachau and Auschwitz. And the one in Dachau, not too many people know about this because it's so horrible, but there was a room that held 400 children before they were brought to the gas chambers the next morning. They were stripped of their clothes, brought into this room, holding room, held about 400 children, made of clay walls, and then brought into the gas chambers the next morning. When Kubler-Ross went in, she thought she'd see a lot of doom and gloom. Instead, she saw big pictures of butterflies carved in the windows or in the clay walls, and that's that sign of hope. So we witness a lot of sadness. We absorb a lot of suffering. And as long as we're aware of that hope, of that resiliency, that's we can provide excellent care. And when the butterfly is breaking out of the chrysalis, if I think it's stuck and it needs a little help and I kind of give it a little tug, it will die. It needs the struggle of breaking out of the chrysalis to pump the fluid in its wings. And if I interfere too soon, that will die. That's a great metaphor for me to sit with the suffering. I don't have to fix it. I can just sit in the wilderness of the soul with them, and how helpful that will be around that. My last story, and then we'll open up for questions. I worked at Canuck Place Children's Hospice. I was their executive director for a couple of years. And part of my job was to go to golf tournaments and receive ridiculously large checks, which were very, very nice. I went to 77 golf tournaments that summer. I don't play golf. I was so tired of steak dinner, it was unbelievable. But one of them, where we raised the most money, a guy came up to me. I recognized him right away. Very famous CFL football player, played his whole career with the BC Lions. He said, I just retired. He said I could share the story, but I can't tell you his name. So I'm making sure it doesn't slip out. He said, if there's anything I can do, let me know. I just retired for the hospice, I'd be glad to. He gave me his card, and I came back to the hospice and threw it in my desk. About 3 weeks later, we had a 14-year-old boy him and his mom and dad had to fly in, had to take 2 ferries and then fly into Vancouver. They lived very remotely. Huge fans of the BC Lions. They had posters and jerseys hanging, but because of being so remotely, they never been to a game or met a football player. Oh, I got an idea. So I call the guy, I tell him the story, 14-year-old boy with stomach cancer, end of life care. His parents are staying here. He'll be here. Um, Great fans of you guys. When can you come? Well, there was that long pregnant pause, and he said, well, I was thinking of doing a golf tournament. I don't think I can talk about it to a child that's dying. I said, look, just come and talk about football. You won 2 Grey Cups. Talk about the Grey Cups. If it gets uncomfortable, I promise I'll get you out. So we agreed on a time later that week. I met him in the parking lot. Uh, he gets out of his car, empty-handed. No autographed football, no autographed jersey, empty-handed. So I thought. I didn't tell the parents, or the little guy. They walk in and he's just bouncing off his bed. He recognized him right away, and he knew how to use our conference call system. So he conference called 4 buddies back home, and you'll never guess who's in my room. Say something, say something. So they talked a bit. They hung up, and they had about an hour conversation. And then the little boy said, the real difficulty about dying, he had never said that word. It was a very closed family system, and they weren't talking about that. But he's the one that led. The problem about dying is that I'll never be able to play football. Everybody's head went to the floor, and I'm about to yank the football player out. And what does he do? He slips off his Grey Cup ring and gives it to the little boy. He says, when the pain gets too much, I just want you to squeeze that ring. And when you get scared, you squeeze it even harder. And when you're lonely, just hold on to that ring. And when you're done with it, just get it back to your mom and dad, and they'll get it back to me. We all have Grey Cup rings. Some of them are bright and shiny on full display, and some of them are in bottom of purses or pockets or drawers, but we all have Grey Cup rings. And as long as we're aware of the cost of slipping off those Grey Cup rings, of sharing that excellent and compassionate care that you provide, as long as we're aware of that impact, we can continue to provide that presence, that holding space, and being available to people at a time that's really important. So I'm going to leave it at that. And let's just open up to comments, questions, reflections.
Thank you so much, Eugene. Wow, that was an incredible presentation. And I can just speak on my behalf to say, there are so many of the stories that touch me on a personal level, my own experiences with losing my dad, and at the local Clinton hospital, where I know you're very close to, and the nurse there actually suggested the same thing, that we open the window, and that she said that was one thought, and that the soul could leave. But I also thought so many of your breaking down of the truths and the myths and the truths of what we've believed, that how we get over death and our own pain, but yeah, and your stories of how really people whose job it is to go out there and save people and be first responders need so much care themselves. So many of the things that you touched on in the last hour have been so incredibly moving and important. So I'd love to hear anybody else's questions or comments.
When I do presentations to first responders, I do a special one where it's the first responders and their partners. And it's just about how to handle these difficult calls. And so as soon as the first responder comes home, the partner says, we're going to cover 3 questions, and you get to choose which one. So the questions are, do you need to eat? Do you need to sleep? Or do you need to talk? We're going to cover all 3, but you get the choice. And I think that's just a really good model for us. We have to provide really good self-care before we can do the talking around that. And what COVID has taught us, there is a role for doing this virtually. I did 20 debriefings when those 26 murders in Nova Scotia. There were 17 different crime scenes, and so there was over 200 first responders. And the beauty about the format that we did was they could ask questions anonymously, and we got to some real heart issues that were important. Comments, questions, reflections? On the handout, you'll see that I leave my phone number and email. I'm scheduled to do some painting in the next week that I would love to get out of. So if you have any comments or questions, send me an email and I'd be glad to.
So we do have a question from Bev from Music Care by room 217. Oh, where did the question go?
Did I
It
have
was,
a,
do you have, can you see the question? It's gone. It's, do you have a special song? Yeah, do you have a special song that you go to for your own self-care?
Yeah. I'm a huge John Denver fan, and this old guitar, it was the one his grandmother gave him. So I used to play guitar. I've gotten back to it. I just do it for myself, and so that's really helpful. When I was working at the hospice and hospital in Stratford to Bayfield, it's about an hour, where Mitchell is halfway. So when work gets me until the welcome sign to Mitchell, and then from Mitchell on, I'm done. So what I do is I slip in a CD. So sometimes it's John Denver, sometimes it's the Doobie Brothers. Depends what mood I'm in. But I have been more and more incorporating music in my clinical work, and it's just made it rich around that aspect.
That's really interesting, Eugene. I know I've heard similar stories from teachers who, have tough lives and they have a lot to deal with as well. But and sometimes they're so busy bottling up their emotions all day that they have to get into the car and they have to put on their song, and then they do their crying. So it's really important for that. So there's some really great comments that we've got here. So many of the little tips that you shared with us, like the the box breathing, very, very helpful.
Eugene, are you able to see the chat?
Yep.
Okay. Oh, good.
Yep. The new grief from somebody who's died from MAID has really changed our work. So I said I would never abandon any of my patients. We see MAID as not a tool in the palliative care toolkit, but I said I would never abandon anybody. So I've been present for about 80 MAIDs, and that I'd be glad to do a presentation on MAID and grief down the road, or anything else. I just think your organization, I've had this, when room 217 had first started, Bev gave me those CDs, and I remember she also gave me some handouts about the CDs, and I just happened to be asked to give a presentation in Ireland. So I had like 200 of the cards. So I handed them out in Ireland, and then Bev was wondering, how come we're getting so many requests for our CDs in Ireland? When I first started. So I said, oh, I think I can tell you why.
Thanks, Eugene. That's great. There's a comment by Rini, she says, I like the session where everyone brings a song. And I think that a song to present, I think that's such a great idea, because even you talking about John Denver, I mean, John Denver is not somebody that I would, not a go-to, but I like just even thinking of John Denver's songs, like, oh, it brings that sort of gulp of emotion. So even though, it's not my go-to, I totally I can feel the emotion in my heart. So it's not just the songs that are important to you, but just connecting through song as well. Like, oh, that song's meaningful to you. I never realized how meaningful it was to me too.
did a presentation in Thunder Bay a couple weeks ago, and I went the night before, and I was in the conference center's restaurant, and there was 6 First Nations men there, all in wheelchairs, and they all had had a leg amputation, and they were flown in because it was a diabetic clinic. That's why they had lost their leg, and all 6 members were at residential schools. And so when I came in, they said, "Are you by yourself?" I said, "Yeah, well, join us." And we were there for 3 hours, and they shared their story about the residential school and how the direct connection to diabetes. And it was such a powerful experience around that. I've lived a privileged life. I'm white, I'm male, I had a chance to go to university. I've never known war, violence, family violence. I've lived a privileged life, so I need to be aware of my unconscious biases so I can really meet people where they're at.
Definitely. Yeah. We just have a few more moments. Bev's also got a second question. How do you ask someone to present a song? How do you frame it? And is there a guiding question or a prompt?
Yeah, and I've that's great, Beth, because I've changed it a bit. That first one was off the cuff, and then when I found it was so powerful, I now say there's a handout that they get to say, as part of the group, we are going to be reviewing a song of your choice. You always can have a chance to pass. So far, I've never had anybody pass. They've always jumped at the opportunity. It's we are not going to dissect the song. It's more to say, what was it about the song that that supported you through the grief? So there is a kind of a discussion. Now it's gotten a little more prepared. Is it just as effective as off the cuff? It probably is, because it's a little more thought out. We just do one song an evening because it's so powerful that I don't want them to be robbed of that. And it's funny. I try and cover all the themes of anger, rage, guilt, primary emotions. I don't have to say, this evening we're going to cover this. It naturally comes from a particular song around that aspect of it. Drug overdose is now being changed to drug poisoning, which what it is.
Good.
People are putting in fentanyl and carfentanil to get them hooked. They're not any quality control. So if you have 2 or 3 grains too much of carfentanil, the person's going to die. So it takes away the stigma of that.
Yeah.
So that's also the shame and the guilt around drug death by drug poisoning is again another thing that we've been dealing with.
I think that the wording around death from suicide is very important as well, because it takes that, there's the stigma, but also it's almost like a blame. You're committing something. You've overdosed, or you've committed. It's no, suicide is something that happens because you're not well, and it's an illness like anything else, like cancer. So it really does destigmatize that. The language was really important. Well, that we're unfortunately at our hour, but my goodness, we could have spent so much more time. The comments are just piling in. I'm going to spend some time just reading the comments as well. But I do want a little reminder from Tanya, who says, we do, if you're looking for CEU hours, please contact Tanya, because we give a certificate for that. But like I said, maybe we could take some time on our own to go through these comments and questions. And this has been such a meaningful hour for certainly all of us at Room 217, and so many of you who came to join us this afternoon. I can't thank you enough, Eugene. We're going to be having you back.
Up to.
Yeah, in all the ways that we can, to come see us at webinars or conference. It's lovely to have a partner like you with Room 217. So thank you so much, all of you who've joined us, and we look forward to seeing you next month. And do reach out if you have any questions about any of our programs.
And
Thank you so much.
I'll send you the handouts tomorrow.
Thank you so much. Wonderful.
Good.
Have a great afternoon, everyone.